Introduce now Mayor Pete Buttigieg to give his opening remarks. Thank you.
Well, thank you so much for having us, for all of your work, and to all of you for the opportunity to come together. It's a timely visit because we're very proud this weekend to be rolling out our comprehensive plan for Americans with disabilities, touching so many areas that we may not get to cover all of them today. So I will also encourage you to check out our plan. It's about, I think, 19 pages on peteforamerica.com. But let me emphasize, first of all, the philosophy behind all of this, and then maybe touch a minute or a moment or two in the plan before Senator Hogue waves me to my seat. So part of the basic idea of our campaign is that we need to open a season of belonging in American life, and that Americans right now, in countless different ways and for countless different reasons, have been put on the wrong side of fences of belonging. I felt this in one very particular way in my own life, but have found that every voter I meet struggles with these same issues. And that sounds maybe broader than any particular policy concern, but I believe our policies must be motivated by ensuring that everybody knows they have an equal claim on the blessings of American life. And it matters who is in the White House in terms of our tone, as well as our philosophy, as well as our administration, as well as our legislation, how we come at this. So our plan, I'm proud to say, has been informed by activists, some of them in this room, by people sharing their experiences and the experiences of those they love. And I'm looking forward to digging into it shortly.
Thank you. And I will make a request of you that instead of standing up, which I think is sometimes a response to wanting to answer a question, if you could remain seated, because it helps folks who need CART and also ASL interpretation.
Very good.
So, thank you. You're welcome. I was reminded of that.
Good flag.
So, it feels like many of today's elected officials and much of society is still stuck in the mindset that people with disabilities are less than, and that we just are a governmental cost and a burden. We actually are a pretty amazing group of people whose strengths, right? We mentioned that earlier. We've got a lot of flexibility and we can adapt pretty quickly here. And our strengths greatly overshadow our weaknesses. With the improvements in healthcare, we are living longer, healthier lives. With advances in technology, our abilities to think differently than others, well, as we say, temporarily abled people, because we all know we age into disability if we live long enough, right? Our problem-solving expertise should be valued, and we should be seen as really an investment. In your campaign and in your presidency, how will you assist the United States in changing societal views on disability, and how does that relate to being a change agent?
Well, I love the way you frame that question, because I think we need to move from a mentality or a framework that is about what can be done just for or to even people with disabilities, to one that's really about how do we unlock everyone's potential contribution in this country. It's one of the reasons why there's a big focus, for example, on workforce in our plan. As a matter of fact, we have set a goal inspired by Senator Harkin's work, that by 2030 we double the rate of workforce participation by Americans with disabilities. And the virtue of this, of course, is not only that it is a benefit to those future workers with disabilities, but also that the whole country is better off for their contributions in the workplace. And each of the specific measures that we're undertaking, from ending the sub-minimum wage to ensuring that we have apprenticeships and internships that recruit more people with disabilities into the workforce, is about not only extending opportunity, but unlocking contributions. The same could be said of so many different areas of American life, starting really with the educational system. And again, if we're doing a good job, whether it's fully funding the IDEA, or ensuring that we meet another target that is a little harder to hold in our head than double by 2030. It's 85, 80, 25. So the idea here is that 85% of students with intellectual or multiple disabilities are in a general education classroom environment 80% of the time, by 2025. We believe we can do that, and that again not only makes these students better off, but it makes the classrooms better off for having that diversity of experience in the classroom. And so the more we think about this as how to make our communities more fulfilled in our country, better served, the more I think we're going to find that everybody wins. It's like the curb cut effect, and I'm sure it's not new to folks here, that any, you have curb cuts that were an innovation to help people using wheelchairs that now everybody who's ever pushed a stroller or pulled a rollerboard benefits from without even thinking about it. It's an example of how we all do better when we all do better.
Thank you. You brought up education, and the IDEA was passed in 1975. We still have children with disabilities. Try it again? Okay, there we go. Children with disabilities, especially those who are also people of color, often have unequal access to educational resources, despite the law guaranteeing such. This becomes a question of enforcement and a question of how you will. So you've addressed that you feel that it's important for us to do this. So the question really becomes, how are you going to do things differently than what we've already been doing?
Right. So part of it, of course, as I said, is a matter of fully funding the federal government's obligations under IDEA. We have to make sure that federal policy is leading the way, even if a lot of these decisions are being made at a state and local level. But also from an enforcement perspective, we can press states to do the right thing. And I think that's especially important as we look at guidance and eventually rules that do away with the over-reliance, for example, on segregation of students. And then you add to that things that we need to do away with completely: corporal punishment, restraint, seclusion, that almost sentence people to being in a separate class of citizenship from very early in life. And of course contribute to things like the overrepresentation of people with disabilities in the criminal justice system. So we have got to do the right thing starting at the earliest years, and federal leadership is crucial to making that happen.
Thank you. So now that kind of transitions easily into housing. So the ADA's integration mandate and the Supreme Court's Olmstead decision provided people with disabilities with critically important rights to live, to work, and receive services in the most integrated setting appropriate. These rights have enabled tens of thousands of people with disabilities to move from institutions into their own homes. However, the lack of affordable, accessible housing has taken a toll on the lives of people with disabilities who continue to not have a choice in where they live and then are forced into nursing homes, psychiatric hospitals, board and care homes, developmental disability institutions, and other institutional settings. What specific steps would your administration take to address this disparity?
Well, first of all, personnel is policy, and so you can expect me to appoint a leader of the Civil Rights Division in the Department of Justice and a Secretary of Housing and Urban Development who understands disability rights, understands Olmstead, and understands the necessity of ensuring that there is an abundance of safe, accessible, affordable housing. Secondly, we need to reinstate the affirmatively furthering fair housing rule. This is a rule that HUD had that compelled a level of not just compliance, but directly working to make sure that there is more fair housing from a civil rights perspective. One of many good policies that has been undercut or removed by the Trump administration. Another thing that we got to do is put some resources behind this. We've got to finance the building of fully accessible public housing on the road ahead. And we got to establish a national database so that subsidized housing, even if it's grandfathered in, under Section 8, for example, that we can identify where there are those units that are accessible, and of course over the long run use those carrots and sticks of the federal government so that more of them are accessible to begin with. We can also work with local governments, and we've seen this as on the receiving end in South Bend of what it means to try to figure this out alone versus what we could be doing if there were more federal leadership. So these are some of the elements of things we can do that would make a huge difference in terms of the availability of housing. And you add to that the bigger picture that we have an affordable housing crisis in this country, in so many parts of the country. And we know that disproportionately harms Americans with disabilities. All the more reason why we need broadly to ensure that more affordable, accessible housing gets built in the first place, but also that we're doing things like promoting inclusionary zoning so that we continue to move in the right direction with what's available out there.
So, onto the subject of mental health. Iowa is known for its quality of mental health care. The Department of Justice has found, and many state governments have acknowledged, that significant numbers of people with psychiatric disabilities have hospital admissions and could be avoided or shortened if sufficient community-based services were available. How would you incentivize professionals to go into the mental health field?
Yeah. So the place we need to get to as a country is where it is as routine to talk about and act on mental health issues, including serious mental illness, as we would a physical health challenge. That it would be as normal to talk about bipolar disorder as it would be to talk about a knee surgery. And that starts at the top with making it okay to have these conversations. There's also some very real and concrete policy implications to this. The key word that I heard you say was community-based. And I think this is so important, especially as we continue to move beyond the sort of institutional framework that unfortunately this president has gestured that he would want to go back to. And what we would be well served to do is recognize that local communities will come up with answers that may be different in different parts of the country. The answers don't all have to come from Washington, but I think the dollars should. And so a big part of our plan on mental health that is we released as a separate plan, but really ties in here, is healing and belonging grants that support providers, support the development of community resources, and support that broader effort I was talking about of creating a sense of belonging, and fund those from the federal government, but allow communities to decide for themselves what makes the most sense. That, plus expanding the availability of telehealth and telemedicine, which is especially useful in the context of mental health provider support when we're supplementing in-person care. But also, in order to get that right, we got to make sure that there's more access to broadband. And it's one of the reasons why we're proposing $80 billion to make sure that every part of America, whether it's wireless or fiber, has access to quality internet connections. We know that that can bring a lot of benefit, disproportionate benefit, to people living with disabilities and to people with mental health challenges who could take advantage of more of these kinds of resources if we had that connectivity.
Thank you. And at this time, I'd like to please welcome Dr. Cindy Hannawalt up to the stage. She's the immediate past president of the Lynn County Medical Society.
Hi, thanks for joining us today. I'd like to start with talking about some of the issues we have for healthcare coverage. Many times policyholders are denied coverage for treatment plans, procedures, and medications. How can insurance companies be dealt with to help comply with the standards that we need for providing quality healthcare?
Great. So two things have to happen. First of all, we have to enforce to require that insurance companies do the right thing, and that these exclusions, which are often unlawful and always discriminatory, are not acceptable in the private insurance market. But also, I want to create a place to go when the private insurance market is letting you down. And that's the idea of Medicare for all who want it. I actually think it's so good that everybody's going to want it, and eventually it will become the single payer. But I'm not willing to assume that that's going to work for everybody before it's out there. So the idea of Medicare for all who want it is we create a public Medicare-like alternative. Anybody can have access to it, and we'll make sure that it's affordable with an 8.5% of income cap on the premium. And that plan will most certainly not have the problems that you're describing that some private insurance plans do. Because we need to raise the standard for what care means. By the way, this is also the case in terms of people's ability to get community-based and often home-based care. And again, this is largely a question of enforcement, but also leading by example with a better public plan that won't have those problems.
Thank you. And that made me think of some of the struggles that we also face right now with trying to get certain testing or procedures ordered. It's not uncommon that as a physician, if I want to order a CT scan or an MRI, that I have to go through several hoops. Sometimes it makes a difference in the same day of care. And so we have to hire more staff, and there's more administrative burden and more time out of my day. And ultimately, the patient gets left behind, or they get turfed to the emergency room for care that isn't necessary. How do you propose that you can help us as providers try to get through some of those administrative burdens?
Well, as a country, we spend more of our healthcare dollar on administrative burden and less relative to patient care than pretty much any other developed country. And two sets of things need to happen. One, I believe when we create this Medicare for All Who Want It plan, because of the scale of it, and because of the purchasing power of it, it will be more efficient and you'll see less of this administrative burden. But the truth is, that's not enough. Just look at regular Medicare, right, which has quite a bit of administrative burden on its own. And as we are fretting over the effects that automation, for example, might have, there are some areas where I would love to see more automation, and one of them is this kind of administrativia. The number of human hands that ought to touch a prior authorization is probably zero, but that's not how it works right now. And so we've got to make sure that it's not as glamorous as the big debate, the big fights over how coverage is going to work, but there's a lot of work under the hood that has to happen in order to make sure that this administration works more cleanly. The technology is there, but it's not always applied. And we need to make sure that, especially within CMS, within the Medicare and Medicaid system, that we are simplifying and improving these processes so that those who are trained in patient care can spend more of their time on that and less of their time on the bureaucracy.
Okay, thank you. Now, I'm going to switch gears just a little bit and talk about a problem that physicians face and more healthcare workers are facing. 300 to 400 physicians kill themselves each year, a rate of 28 to 40 per 100,000, more than double the rate of the general population based on a 10-year lit review by the American Psychiatric Association. How would you provide support to physicians to help reduce the stresses causing them to increase the risk in their suicide rate and cause thousands of doctors to retire early or leave patient care altogether?
It doesn't get talked about much, and I'm glad you raised it. I belong also to a community, actually a couple communities, as a gay veteran, that remind me that there are some communities in America that are disproportionately liable to die by suicide. And it's often a problem that is not seen until it's too late and not talked about before, during, and after. And so what I think we need to do is, first of all, support the profession by recognizing that professional development in any profession has to include self-care. And we've been in a process back home right now with police officers where there's so much emphasis on their well-being from the neck down, and very little bit paid to what happens when you're in a stressful role like that. It's the same with physicians who are experiencing life and death situations constantly, who experience enormous pressure. And also there are some reforms that are probably due in the education process of becoming a physician. That if we take a rigorous mental health oriented approach to the effects that some of those stresses have, might lead us to structure things a little bit differently. And so I think it's another example of how, with the right kind of leadership in the Department of Health and Human Services, tasking some of our federal resources to both research and mitigate these stresses, we can create guidance that would help get ahead of these issues, promote self-care, and identify the greatest stressors that contribute to these risks.
Thank you. I appreciate you. All right. So along those line of questionings, you talked about the healthcare costs, and we've seen, even over my 18 years of practice, the cost of healthcare continues to rise. And we talked about the administrative burdens. So on a practical level, how do you feel we can decrease some of the waste associated with healthcare, and how we can deliver more efficient healthcare?
Yeah, so here again, I think part of it is solved if we crack the coverage issue, because we will have in the Medicare plan that I propose to make available to all Americans a structure that then becomes the standard that everybody's following, that everybody will notice when there's a weakness in it and be able to weigh in and correct it, and that kind of shows what the maximally efficient plan ought to be like. But this is also working to make sure that all payers, all insurers in the country have a certain standard to live up to in terms of the bureaucracy. I also think that some of the waste we see gets better controlled if we have controls on cost. And it's one of the reasons why, for example, our plan calls for a cap on surprise billing, that even if you're out of network, it can't be more than a 200% multiplier of the Medicare reimbursement rate. Because if money is literally no object, that's where the most waste takes place. And we see that happen. And so it is on the provider side, not just the insurance side, that we've got to make these improvements.
Thank you. That's the last of my questions. Do you have any closing remarks?
Yeah, for sure. I wish I could. We could do another half hour on this because there's a whole bunch of other things that I hope you will take an opportunity to look at through the plan that we've put together. It is including reforms that we think are needed to SSDI, to Medicare eligibility for folks on SSDI. So, a 24-month waiting period that costs some people their lives. We estimate conservatively we save 10,000 lives or more just by fixing that. We know that this is, in many ways, a rights issue, and a shocking proportion of polling places are not accessible to voters with disabilities, and we need to act on that. So this is a question of power, frankly, as well as a question of policy. There's so many elements of the plan that I want to share. I want to make sure I give credit. We have a fantastic team, one member of whom is here, and I just got to ask her to give a quick wave. Emily Vorty on our team, who she's actually on our campaign by way of her superior logistical abilities. She works with Chasten, but because she also has a lot of expertise on this, helped shape our policy and educate me on a lot of these things. And it's just one of many examples of how our team is better, not just a better workplace for people with disabilities, and has not just made me more educated and capable of talking about issues related to Americans with disabilities, but also just playing a better campaign. In the same way that our country is a better country, and our communities are better communities, and our schools are better schools, and our workplaces are better workplaces for everybody, if we do a better job of making sure that everybody can contribute. There are so many more Americans with disabilities than is even known or understood, because there are visible and invisible disabilities, and because anyone at any point in their life might join this community. And so it is so important for us to recognize that this encompasses so many of us. And the other thing I want to mention by way of the power of this community is that I reflected once as a member of the LGBTQ community. I thought, one thing that's really special about our community is it's a minority that is kind of evenly distributed, as far as I can guess, across every geography and race and income group and family background and profession. And then it was pointed out to me that that's not just true of that community, that's also true of the disability community, which means at a moment when we are frighteningly fractured as a country, to the extent that this is a community, it is an exceptionally diverse, internally diverse community. And I think that gives you, as you continue to use your political force, to call political figures to account to respond to you, I think that gives you power to mobilize in a way that connects and builds bridges across a great many people who have been isolated or separated from one another because they are from different religions or races or regions or whatever it is. And I hope you find in that the opportunity to provide some of that crucial knitting back together of the social fabric of this country that I, as I hopefully become president, will be relying on the American people to do as we pick up the pieces that first day after the Trump presidency has come to an end. So thanks for everything you do. I look forward to working with you.
Thank you very much, Mayor Pete. We will be on a